As we find ourselves in the midst of yet another phase of mission begin again, many of us are actually struggling to unlock and restart our own lives. Restrictions around us have been lifted, even though the number of new cases continues to rise every day. Resuming one's work and one's routine in this climate is often fraught with fear, uncertainty on one hand, and a false sense of security on the other. The new normal is a buzz phrase that gives rise to mixed feelings of both dread and a quiet acceptance. What started out as a wave of fear and panic has now slowly begun to find its own level. We've realized how little we actually need. We've learned to find pleasure in things we often didn't make time for. And we've adapted to new roles and new responsibilities in our lives. As we endeavor to return to what was, we cannot jumpstart our engines. This must be a measured, gradual transition into a tailored, reformed routine. In the course of this talk, I'm going to outline a few broad suggestions on safety tips. But before that, I would like to emphasize 3 broad dictums that universally apply to every outdoor activity that you will engage in. Number 1, determine your individual level of risk. There is no one-size-fits-all. Resuming your activities must be a carefully calculated approach based on your age, your health factors. Are you diabetic? Do you have any other chronic illnesses? Your family situation. Do you live in a nuclear family? Do you live in a joint family? Do you have children in the house, elderly parents in the house, elderly dependents in the house? Do you have provision for adequate isolation if you should become positive or be exposed to a positive COVID patient? All these things must be thought over. There must be some kind of contingency plan in your mind before you restart. Number 2, masks are a universal recommendation. There is enough evidence in their favor. However, they also give us a sense of security that they're protecting us. But in truth, I mask for you and you mask for me. Masks serve a much greater role in protecting others from our potentially infected droplets. So regardless of how robust your mask is, N95, N99, if your grocer who you're having a conversation with, or your colleague at work, or your neighbor who you're taking a walk with, hasn't worn a mask which properly covers their nose and mouth, if they're wearing their mask below their nose or at their chin, you are not protected. We need to make this our collective responsibility to educate people in our community about mask etiquette without feeling embarrassed about it. Number 3, what is considered a significant contact for COVID transmission? As numbers increase in the community, it's inevitable that when we step out, we will make contact with somebody or the other who's transmitting the virus. So am I at risk if I cross somebody on my morning walk who's COVID positive? Am I at risk if the lift man who's with me in the lift is COVID positive? What is defined as a significant contact? And that is unprotected exposure. And by unprotected, I mean without a mask or face shield, within 6 feet of an infected individual for more than 10 to 15 minutes. So to answer your questions about a lift man or somebody who crosses your path at work, or while you're taking a walk or going about your routine activities, you are not at risk. If you can keep a 6 feet distance, if you can ensure that anybody that you come in close contact with is masked and you're masked as well, and that you can restrict your interactions at a close contact for less than 10 to 15 minutes. This is broadly mentioned in every international and national guideline, and it's widely accepted. So these 3 dictums are something that you need to remember, and I'm going to emphasize them, re-emphasize them actually. Determining your level of individual risk. I mask for you, you mask for me, and what constitutes a significant contact for COVID transmission. With that, I'm going to move on to stepping out. And stepping out can actually resuming your activities can be broadly categorized into resuming routine activities, resuming work, and resuming leisure. So if we start with the routine activities, groceries, essentials like going to the chemist, going to the bank, these essential activities have actually been open throughout the lockdown, and many of us have been going ahead with them as normal. Some important useful tips to remember are that transmission is much lower in an outdoor, well-ventilated space. So it's a good idea to do your grocery shopping at the vegetable man down the road or in the open-air market rather than the close confines of a supermarket. Make sure you take a list with you, keep your interactions to a minimum, choose a time when there isn't too much crowding. What about other things like going to the hairdressers, to the barbers? The government has sort of allowed the barber shops to reopen in one of the recent phases of the mission. It's still avoidable for elderly people, people with high risks. If you can avoid it, avoid it. Make sure that your salon is adhering to the norms, the directives set out by the government in terms of social distancing, in terms of following disinfection directives. Take an appointment. Make sure that you're not made to sit there with a lot of other people. You will need to carry a mask with ear loops so that you don't need to untie your mask and take it out while you're having your haircut. Ensure that your hairdresser has washed their hands, worn a new pair of gloves, has completely covered their face with a face visor or a face mask, and doesn't keep touching and adjusting their facial apparatus while they are sort of tending to you. What about other things like exercise, gym, sports? These are essentials in my opinion. And outdoor non-contact sports are absolutely safe. So walking, jogging, cycling, yoga exercises in the open, tennis, these are all relatively much safer than anything else. Avoid using an N95 or a well-fitted tight mask while you're exercising. This can cause suffocation and can actually cause you to feel faint even. A clean, simple cloth mask allows breathability, especially if you're walking with friends or neighbors. The government has recently released guidelines for gyms and yoga institutes, keeping in mind the importance of exercise in building our immunity against this virus. These are available on the Ministry of Health and Family Welfare website. Ensure that your gym is also adhering to these directives. Some important useful tips given in the guideline is to avoid yogic kriyas indoors because these involve a lot of deep breathing and hyperventilation. These should be preferably done outdoors. Face shields and visors are actually preferable to masks, which can be suffocating as you exercise in the gym. And it's a good idea to actually carry your own equipment, like a water bottle or a yoga mat to, avoid sharing it with other people at the gym. One very important aspect of resuming routine activities is going to the doctor, going to the hospital. Fear of the contagion has made a lot of people actually ignore important other health conditions, diseases. There have been numerous delays in seeking essential medical help and avoiding routine follow-ups. Please don't do this. Looking after your other health conditions is equally important, especially at this time. You may continue with your routine follow-ups if it's just a top-up of medication or continuation on teleconsultations with your physician, but otherwise, take an appointment well in advance. Make sure that you're not sitting in a crowded waiting room of a doctor. And please go ahead and resume your consultations and your follow-ups for any health reasons. Be sure to inform your doctor if you have any symptoms suggestive of COVID, or you have a family member or a close contact who is sick. They will actually direct you to a safe room of a hospital or to a fever clinic where you will be attended to. Don't sit in a waiting room and potentially infect other people if you have any suspicion of the infection yourself. With that, let's move on to resuming work. I think it's not possible to just wake up one day and open your shutters and start work like you would earlier. One needs to develop a strategy for cautious reopening. You need to figure out how you're going to implement that strategy. maintain it, revise it from time to time. We know that all shops and businesses have been given the green signal to reopen. However, we must remember that a lot of our office spaces are enclosed, confined spaces, central ACs, poorly ventilated. And we must ensure as employers, as employees, that attention has been paid to this. Again, there are broad guidelines internationally and nationally on the CDC, WHO, OSHA guidelines by our own Ministry of Health that amply describe, how to go about restarting an office, disinfection, adequate ventilation in your office spaces. It's important for us to classify our job and the roles of our co-workers, our employees, by their exposure risk. So there will be some people in every office that are considered to be working in a high density population environment, like perhaps the watchman, the receptionist, who actually is the interface for a lot of people coming into the workplace. These employees should be adequately trained as to how to protect themselves, and they should be empowered with appropriate personal protective equipment. It's a good idea to put up acrylic shields, large acrylic sheets that actually sort of act as a barrier for people who make a lot of public contact in their workspace. Staggered staffing, staggered timings is a very good idea. It's something that we need to adhere to even now, especially for employees who are high risk of severe illness, especially for people who will be using public transport. Encourage them to work from home as and when possible. People who travel by taxis, private cars, make sure that the drivers are also masked. You have the windows down as far as possible. Social distancing, hand hygiene, masking cannot be overemphasized in the workplace. And at all times, remember not to let your guard down. So although we may be careful while we're working at our workspaces, we let our guard down when we're having a coffee with colleagues, when we're going out for a smoke, when we're standing in the pantry or the restroom. And this is where transmission actually occurs. So it's a good idea to carry a packed meal with you, a bottle of water with you, a napkin from home, and actually eat alone at your workspace. Reporting sick policies should be made very clear. We need to encourage our colleagues, our workers, to inform us in advance if they have any symptoms suggestive of COVID, not come into work if they have a sick relative, somebody who is a suspect or a positive case. What about disinfection? Again, as I mentioned earlier, very well given in most of the guidelines. You can go through this. The one on the Ministry of Health and Family Welfare website, the Indian guideline, actually even discusses how to prepare the disinfectant solutions from commonly available items in the market, where these need to be used. You'll need to explain to the sanitation staff how to prepare it, what needs to be used where, and it's a good idea to actually spend a little time disinfecting your own workspace with perhaps an alcohol wipe, especially on frequently touched surfaces like your computer keyboard, light switches, handles, other gadgets. You also need to look after the sanitation staff and explain to them how to protect themselves, give them sort of durable gloves and masks and everything that they would need to protect themselves as they go about cleaning your workspace. I would suggest bathing as soon as you come home, having your clothes washed, hot laundry, a sort of hot washing machine wash, washing your mask as soon as you come home, and disinfecting your mobile phone, your wallet, your keys, and other gadgets with alcohol wipes. And finally, let's talk a little bit about resuming leisure. So have we reached there yet? Can we actually think about resuming leisure activities? We've all been aching to see family and friends that we haven't met for months on end. But we still need to be especially careful about visiting vulnerable relatives or friends. Make sure that you're masked, that you meet them in an open, sort of, well-ventilated part of the house, the balcony, or, near an open window with a fan on, and avoid having meals together as yet. Parties, get-togethers, especially for high-risk individuals, is still not recommended at all. What about holidays and travel? Can we afford to think about it at this stage? Well, although there has been a gradual lifting of travel restrictions, this is definitely a priority for essential travel for work, and holidays by air or rail are still a distant dream, so to say. But road trips, treks, hikes, booking a small staycation villa or an outdoor resort on a beach, a mountain resort, a forest lodge are actually things that you can consider and are relatively safer if you can adhere to the norms of social distancing in these places. Well, we all need a holiday, and it would be great to take one. So you could plan one of these things. So finally, as we gear up to reboot our lives, I hope that we do this slowly. We try to find a balance and a renewed sense of purpose. And with that, I will conclude my talk by a little twist in the common Corona catchphrase. Stay safe as you step out. Thank you for listening.